Hey, Dr. Katie, excited to have you on the podcast.
Thanks for having me. I'm really excited to be here.
Awesome. If you could share with us really how you came to do this work.
Yeah, so I am a dentist. I started practicing in 2010 here in Aurora, Colorado. So I have about 12 and a half years under my belt. Kind of a really long backstory, but I think what is most pertinent is when I was in high school, I crashed into a telephone pole on a four-wheeler or an ATV. Wasn't wearing a helmet. The only time I didn't have a helmet on, broke everything from my eyebrows down, had my jaws wired shut for 2 months. They were wired shut with broken teeth, missing teeth, things like that. And then after the wires came off, my jaw was fused shut. So it took 4 years and 9 reconstructive surgeries to reconstruct my face, but also reconstruct my jaw so that I could open my mouth. So I had 4 years of horrific dental disease and not being able to eat and not being able to treat the infections. And so I saw first or experienced firsthand really how oral health affects overall health. Depression, anxiety, all those things, but then also lost a ton of weight, got down below 100 pounds, organs started shutting down, liver enzyme spike, kidneys started malfunctioning because I couldn't eat properly. And I had abscesses everywhere. So finally, senior year of high school, everything got fixed. Teeth got fixed. They were the last things to get fixed, and my health improved dramatically. So that got me into dentistry. But then over time, what I started noticing just a few years in was just how much oral health affects systemic health. And I started diving into salivary testing because I wanted to be able to see what I couldn't see, right? You can't really see bacteria in the mouth. So I started looking at some tests and had a couple really important cases that came into my practice that I was able to help them. And then specifically, I myself was a fertility patient. I had 6 years of failed IVF treatments, 4 miscarriages. I did finally have a son in May, so that's really exciting. But it was really mind boggling to me that the entire time I was going through treatment, and I was at the best fertility centers in America, not one clinician asked me about my oral health. And there's so many studies out there talking about the impact oral health has on fertility. And I experienced it firsthand helping couples within my practice get pregnant by improving their oral health. So I sold all my practices. That was part of having a baby. Wrote a book called Saved by the Mouth just to arm patients with the information that I have to try and just help them on their overall wellness journey, whatever it be. So that's where I'm at today.
Yeah, that's quite a story. And funny enough, today I did go to the dentist. So
Yay. Okay, good.
I'm like, oh geez, not a fun place to be. Like
No.
I've never had a cavity, so there's no issues, but I'm like, what's with the upselling at the dentist? I have no
Yeah.
idea what's going on. I'm like, I've never had a cavity, guys. I'm
Yeah.
fine. Oh, I
Yeah.
think you need this and need that. No, I don't need anything. Just clean my teeth. Anyways,
I've been told that people loathe the dentist as much as gynecologists and DMVs. That's what we're always compared to. So we hear it all the time.
yeah, I think there's also I heard there's like high suicide in with people that with dentists too, because it's like you're not even able to talk to people. You got the tools in their mouth. I know my dentist would come in for a couple minutes and be like hi and bye, and then yeah, it's a
Yeah.
interesting
Well,
field.
and we're always told how much people don't like us. So I think that
Yeah,
contributes to the suicide rate too.
yeah. So yeah, and that journey that you went to all your with that ATV. I have some family members that do that ATV piece, and I'm like always like, ooh, I feel that's very dangerous.
Yeah, yeah.
Yeah, that's
I grew up in the country, so I rode them all the time.
okay. Yeah.
It just happened, I believe everything in life happens for a reason. And that day I was just going for a quick ride,
Hmm.
didn't throw my helmet on, and launched me into a career path. So I'm kind of grateful for that,
Yeah.
but it was rough 4 years of recovery for
Yeah,
sure.
absolutely. Yeah. And then here you are as a dentist. So yeah, it's
Yes.
very good. So yeah, the oral microbiome, and I have done some episodes on this as well. This is something, right? Like, as you say, in conventional, medicine, when, with regards to fertility, and we specialize with couples that have low AMH and or high FSH, diminished ovarian reserve, premature ovarian insufficiency. So typically, they've been told donor eggs are their only option. They've been told to rush to IVF, and then no one is looking at their health. And also, I shouldn't say no one. Most people have made some sort of changes. Maybe they read it starts with the egg, and they've taken out some of the toxins and taken all the supplements, but not in a very targeted manner. And then you go and ask your REI, hey, does looking at, targeted diet and lifestyle matter? And they're like, yeah, it's okay, but it's not essential, which is just completely unhelpful. And we're not anti-IVF, we're pro health. It's so important to work on your health first. You either get pregnant naturally, or if you do go to IVF, you're going to improve your chances of this working. And so the oral microbiome, I don't think anyone's going to think about, hey, I've got something going on. I think we might all know that it's important to take care of your teeth because this could be related to heart disease. Like, we might know that it's a good idea to get the plaque off of our teeth and get a cleaning, although people don't go regularly. I'm very diligent on that. I never miss a cleaning. But so what's the research telling us about the oral microbiome and fertility? What are you seeing?
Yeah. Well, I think, just to back up for a minute, you talked about, we're not anti-IVF, we're pro-health. Even if you are able to get pregnant, right? Pregnant women are still very careful with what they're putting in their bodies because they know that that's going to affect their fetus, right? What's in our mouth still gets into the bloodstream and affects our fetus when you're pregnant. So it's really important to have a healthy oral microbiome and a healthy mouth while you're pregnant, for sure. The research shows us quite a bit. Oral health, it definitely affects our ability to get pregnant in both men and women. It's really important to stress men there too, because they're responsible for 50% of all infertility, which is not well known. So it helps us, or it can prevent us in getting pregnant. It will harm us in keeping the pregnancy. And it also leads to adverse pregnancy outcomes. So all along the journey of having a baby, oral health is critical, and the research really supports that.
Yeah, what are we seeing here then? Anything on with tooth decay or gingivitis or oral thrush, kind of like that, those kind of things? What are we like if someone's like, oh, I've got perfect oral health? Like, how do we know that there's a problem? What do we need to do?
Yeah, that's a really great question. So the main thing that we want to make sure is in check when we're talking about fertility is going to be our gum health. Obviously, we don't want tooth decay or things like that, but the gum health is most important. So, in America, everyone is obsessed with gut health, as they should be, because our gut health really tells us a lot about the inflammatory response in the body. And it also is important for our overall immunity. Well, if we take a step back and we think, how did the bacteria get into the gut? Well, guess what? They got there through the mouth. So if your mouth oral microbiome is not healthy, your gut's not going to be healthy either. And so if someone is experiencing gut issues or systemic inflammation issues, they must look at their mouth, because I can pretty much bet on it that their mouth is not healthy either. I don't think in my, over a decade of practice, I've ever seen someone that had, a gut dysbiosis have healthy gums, and vice versa. It just doesn't happen because they're connected. And so two things are really important here. One is going to be the bacteria in the mouth, because there's certain bacteria that are directly related to fertility or infertility. And then the other thing is the inflammatory response that they cause. So you and I are different. Every person is different. Your body might be able to handle a certain amount of bad bacteria, whereas mine is not able to handle a certain amount of bad bacteria. So our genetics play a role in this, but so does diet, lifestyle, stress, all of it. So it's really important to, if we're going to go down this fertility route, as you said, we want to be as healthy as possible to help us get pregnant. We want to be as healthy as possible so that our baby has the best chance of a healthy life that they can. But then we also just want to make sure we're mitigating any risks. And oral health is it's so easy now to check for this stuff, and it's so easy to fix it, that why wouldn't you just look to make sure that your oral health is in check before doing this?
Yeah, especially with miscarriage too. Can you talk a little bit about that?
Yeah. So there's two bacteria specifically that we test for, that I test for. One is called FN, Fusobacterium nucleatum, and the other one is P. gingivalis. Those two bacteria are very present in the mouth. They very easily go from our gum tissue into the bloodstream, and they love to colonize on the female reproductive system. One of the responses to having that bacteria is going to be inflammation. So the amount of inflammatory response, that's going to be determined by your genetics and epigenetics, but those bacteria are going to prevent ovulation, prevent egg implantation, and prevent our ability to maintain the pregnancy. And then in men, let's not forget about the guys, because, when I was going through fertility, it was all the woman's problem, right? Like my husband was fine. He had the best sperm, the best motility, the best everything. And it was all, issues with me. So I don't want to leave the men out here. But those same bacteria, especially PG, those are going to affect erectile functioning. So a lot of guys have a hard time getting and sustaining an erection because of oral bacteria. The bacteria kill sperm. They slow down their swimming ability, and they change the shape of the sperm as well. So that makes it very hard for a woman to get pregnant if the man also has an oral infection. And then to answer your question about miscarriage, so FN, that bacteria makes it really hard for us to sustain pregnancy. The really sad thing about FN is the toxic metabolites of this specific bacteria are harmful to the fetus and cause stillbirth. So that's horrible. We never want to see that. But then because of having that bacteria in the uterus, we activate our immune system, and we're releasing an enzyme called MMP8, which acts as like a scissor, and it goes in and cuts through the amniotic membrane, leading to premature birth. So we'll see patients with low birth weight babies and premature birth that have oral infections. That was a very scientific response.
Yeah, and that's that is it Fusobacterium nucleatum? Yeah,
Nucleatum.
is the FN, yeah.
Yeah.
Okay. And so, yeah, exactly. And it's really important to work on the health of the male partner too, like you're saying. It's not just about, here we are over here with, if you're focusing on if you have female factor fertility, but 50% of the equation and also 50% of fertility issues can be the male. The man's like, my semen is fine, but is it optimal?
Yeah. Right. Well, and they don't know unless their semen's been tested, they don't know the number, quantity, and quality of the sperm. So, the story that I have in the book about this was I had a young couple come to me. And I had just started doing salivary testing, so I didn't know much about it. And this young couple had been trying to get pregnant for quite a while. And they went to their OB and they said, we don't know why this isn't happening. And the OB said, why don't you go see your dentist? Which is, in my 12 and a half years of practice, that's the only time I've ever heard that. And so they found me not by searching, just I was the local dentist in the area. They had no idea I was doing this testing. And it was evident from her mouth that she had a gum infection. But I said, let's take a saliva test and just see what bacteria are present. And then I said, oh, by the way, husband, we need to test you as well. And he said, well, why are you testing me? I'm not the one carrying the baby. And I said, well, if we clean her mouth up and treat her for specific bacteria, and you're kissing her and trying to get her pregnant, you're just going to transfer your infection back over to her. So I need to make sure you're healthy as well. So we tested both of them. They both had sky high numbers of PG and FN. So we rendered the appropriate care for them. And within 3 months, they were pregnant. Now, I can't say, cause and effect, but that's pretty cool, that we were able to help them. And even if we didn't have anything to do with getting them pregnant, I now know for a fact that her baby and her pregnancy was had a much better shot of being healthy because her mouth was healthy.
Yeah, it's interesting where couples are swapping fluids, right? And so you got H. pylori, all sorts of things going back and forth between, and it's just like, oh, we're treating this person, but we forgot the other person, and
it's like it takes two to tango. It takes two to make a baby. We got to treat both of you.
Exactly. And so the gum disease, how do we know if, like, obviously, if you've got bleeding gum, like, what are some signs that we know that there's a problem with our gums?
Yeah. So the main one is bleeding gums, as you mentioned. So a lot of patients have been told their entire life that bleeding gums is normal. Or when they go to the dentist, their dentist will say, oh, I see some bleeding gums, brush and floss better. And then they send you on your way. That is so inaccurate and not right. If your gums are bleeding, that means that there's an infection. If your colon was bleeding, right? If you went to the bathroom and you saw blood in the toilet, you would be barking down your doctor's door asking for a colonoscopy. Same thing with our gums. If our gums are bleeding, that is not normal. That means something is going on. But a lot of people don't brush properly, and only about 5% of the population flosses, and half of them only do it correctly. So most people don't even realize that they have bleeding gums because they're not in there cleaning them properly. So a lot of times I would hear from patients, my gums don't bleed at home. They only bleed when you poke at them. And so I would just kind of laugh and I'd say, how often are you flossing? And they'd say, never. Or I'd say, you know, when you're brushing and flossing, you're only getting 1 to 2 millimeters below your gum tissue. You have a 5 millimeter pocket and the bacteria live at the base of the pocket. So unless you're going down there and checking the base of the pocket, you're not going to know that they're bleeding. So, but I would say most often, if your gums are bleeding, go see your dentist. Any bleeding is not normal.
Interesting. I know so I don't do gluten, dairy, or corn, and I know if I've been inadvertently glutened, I'm like brushing my teeth. I'm like, oh,
Yep.
there the gums are bleeding. I'm like,
Yeah.
I got my nose will start bleeding and my gums
Yep.
start bleeding.
It's all connected. And that's what people don't understand. You know, if you have a food intolerance, right, and you can't put it into your gut because your gut's going to overreact, you can't put it into your mouth either because your mouth is going to overreact. It's all inflammation. And so it's really important to know what foods you can tolerate or not tolerate. Because oftentimes we will see the initial signs of colitis, Crohn's disease, irritable bowel. They show up usually first in the mouth, like what you're saying. And sometimes it's not bacteria related, as you just pointed out. It's food allergy related, inflammation related. So it's important to have all these things checked. And as dentists, we now have tests that can check for all of this stuff in the mouth.
Is that going to see a biological dentist? Because, the regular run of the mill dentist to me is still trying to pound crest down your throat and like take x-rays and take some fluoride.
Yes.
I don't know.
Yes. So I think it's important. Yes, you want to see more of a biological dentist. I would not call myself a biological dentist because I'm not all the way on the far side of that. But it's very important to see a dentist who's educated in oral systemic health, because you brought up a really important point about crest. I'm not here to say anything bad about the big companies, but if we think about cleaning and sterilizing, and something on the label says, kills 99% of germs. Well, that's not good, because the reason we get gut inflammation and gut dysbiosis is because we wipe out the good bacteria and we help proliferate the bad bacteria. Well, it's the same thing in the mouth. So if you're using something that's killing 99% of all bacteria, non-selective in the mouth, you're getting rid of the good bacteria. And the only ones to survive in that environment are going to be, the zombie apocalyptic bacteria, right? That can thrive on anything. And then they're the ones that are going to keep populating. So I always promote gentle oral health products and oral probiotics and things like that to try and replenish the good in the mouth and keep the good happy.
Yeah, it's the same if you got a parasite or a fungal issue. It's like you can go in with the anti-parasitic or the antifungal, but it's like the atomic bomb going off in there. Then you still need to do the gut repair afterwards. So it's like that low and slow approach to be able to maintain the good and the bad, and the good bacteria, because otherwise it just overgrows. And next thing you know, it's like the dysbiosis and things are coming in. You're intolerant to everything on your favorite food list.
Yes. And so what we always did in my practice is we tested, for bacteria, we tested for inflammation. Another enzyme that we tested for was the MMP8 that I mentioned earlier. That is basically it's a scissor. And so it goes in and it breaks down our gum tissue. And so I'm sure you talk about leaky gut all the time, right? Well, leaky gut is caused by the MMP8 enzyme. So if MMP8 is activated, which is going to be activated from any inflammatory response, be it bacteria, fungi, virus, anything like that, or food intolerances, what have you. It starts breaking down our tissue, our barriers. And so our gums are supposed to be a protective barrier in our mouth, just like our skin protects, the inside body from the outside world. Well, when we have inflammation in our bodies, this enzyme is going to get activated and it starts poking holes in our gum and bone tissue. And then everything that's in the mouth that's supposed to stay in the mouth now gets into the bloodstream. First place it goes is the gut, the heart, the brain, all the places we don't want it to go. So that's how the mouth is connected to the rest of the body. So we would test for not only oral bacteria, but we would test for this enzyme, because I would want to know, is the mouth infected? Are these bacteria affecting other organ systems? But then how much or how quickly is the bacteria from the mouth getting to the rest of the body? So I think it's important to test both.
And so the gums could be a sign. Is like, what about the tongue? Is that any sign there people will look at and go, ooh, something's off?
Oh yeah, for sure. I mean, our tongue health, and I'm not an Eastern medicine practitioner, but our tongue health, there's whole providers that will tell you about tongue health and what it'll tell you about the rest of the body. But one thing to look at on the tongue is, like, if you stick your tongue out and your tongue appears to be hairy or dark, or like have a film on it, that's not a good sign either. You should go to your dentist right away. Acid reflux is a sign of systemic inflammation. It's also a sign of airway health issues, which airway health is very important for our overall health. So any of those things, bleeding gums, bad breath, hairy, filmy, sticky looking tongue, go see your dentist right away to get that checked.
What about sleep apnea or what about snoring?
I'm so glad you brought this up. I love airway health. This is another one that's like missed. So 85% of all people who have airway health issues are undiagnosed, which is wild. And the dentist has perfect access to screen for airway health because we're looking in your mouth. We can see your airway. So dentists should be screening for this. We know that anyone who's grinding their teeth at night, who has acid reflux, heartburn, these are all big signs of airway health issues and they need to get it checked. Sleep apnea, if you get diagnosed with sleep apnea untreated is fatal. It's just a matter of when. Severe sleep apnea is extremely fatal. Mild to moderate can be corrected pretty easily and can keep you from getting to the advanced sleep apnea. But that is something for sure that people need to check. Do you guys do anything with sleep apnea or airway health?
Yeah, like we have them start off with as long as there's no sinus issues, do the mouth taping, so you can see then to keep the old lips sealed shut. It's kind of the other night I was like, "Okay, honey, give me a kiss," and he's like, "Ruff, ruff, ruff." I'm like, "What?" And I'm like, "Oh, you got your mouth tape on."
That's amazing. I love the mouth tape. Yeah, because the thing is that when we're talking about systemic inflammation, right? Our nose is designed to filter the air that we breathe. And we know that unless you have air purifiers in your house, the air that you breathe is dirty. It has allergens, toxins, pollutants, all kinds of stuff. And so when we sleep at night, oftentimes our mouth goes open and we start breathing through our mouth. Well, then that air, we don't have any filtration system through our mouth for the air. So everything we breathe in is going into our lungs. It's initiating a systemic inflammatory response. Any inflammation in the body is not going to be good for fertility. And so one way to ensure you're breathing through your nose is to tape your mouth shut. And so usually what I would tell patients to do is try and do it during the day at first, because people would say, "Oh, I can't breathe through my nose." Well, part of the reason you can't breathe through your nose is because you've always been breathing through your mouth and you've initiated an inflammatory response and your allergies are all messed up. Which is another thing. If you have postnasal drip or allergies, that's usually a sign of airway issues. So I would say tape your mouth shut during the day for a couple hours, start retraining yourself how to breathe through your nose, and then start doing it at night. And most often that solves majority of patients' problems. But the key is to get in and do it early before you develop, a chronic disease like severe sleep apnea.
Yeah, it's really helped my husband too, because his nose would get stuffy during the day.
Yeah.
And we are this new builds everywhere. It's like a big dust ball.
Yeah.
And then his nose would get all stuffy. And then he slaps that on at night, and then he's not getting stuffy, and he helps him breathe better and snoring. Yeah.
So important. And that lowers, systemic inflammation, which is important for your fertility patients. We've got to keep the body as quiet as possible so that we can channel and focus all of our energies on conception and maintaining fertility.
And the brushing and the flossing. So we're all lying when we say we floss. Now I do floss, but I couldn't say it's completely regularly, but it's definitely not daily. Maybe it's 3 to 4 times a week, maybe 3.
That's amazing. You're way ahead of 90% of people.
And so, the flossing piece and then the brushing. Anything you wanted to say there?
Yeah. So I was on another fertility podcast and she was talking about, she's like, "Now we don't want to brush our gums, right?" And I was like, "Oh my gosh, aha moment." So when we brush our teeth, you want to focus the bristles between the junction of the gum tissue and the teeth. The reason is because that's where plaque sits along the teeth at the gum line. And remember, the gums is how bacteria get into our bloodstream and cause issues. So if we want to focus anywhere of cleaning something, you want to be right at that gum line. So brush very gently at the junction between the gum line and the teeth. And make sure you're using an electric toothbrush. A manual toothbrush, you're only going to get about 90 strokes per minute. A manual, you're going to be getting about 1,200, or an electric, you're going to be getting about 1,200. So it's way more efficient. And studies show that patients cover much more of their mouth because of the timing and the beeps if they're using electric. So that's number one. Make sure you're brushing twice a day. That's non-negotiable. And number two, it would be nice to have people floss, especially if they're trying to get pregnant, twice a day. Because teeth have 5 surfaces. And if you're not flossing, you're missing 2 out of the 5. So it's important to try and keep all of the inflammation down. Now, part of inflammation in our gums is associated with vitamins, minerals, food allergies, things like that. So for someone like you who, is very aware of what they should be eating or not be eating, I'm sure you're adequately supplemented. It sounds like you don't have a big inflammatory response most times. So you can get away with not flossing all the time. My husband, for example, he's a dentist too. Between you and me and now all your listeners, if I see him pick up floss, I comment on it. That's how infrequent it is. But he's never had a cavity and has no gum issues. I have a inflammatory marker, IL-6, that's mutated. I know this because I tested. And so my body has a baseline inflammatory status of moderate. So I have to be very careful about anything and everything I do because I'm genetically predisposed to inflammation. So I have to floss twice a day, every day. Otherwise I'm a mess. So every person's different, but if they're trying to conceive or are pregnant, they should be doing it twice a day.
It is interesting when you change your diet then, because I was just reading something talking about that, like if you're taking out some of those top allergens, dairy, gluten, corn, soy, peanuts, eggs, some of those ones, then you're not going to have as much buildup on your teeth. And
totally.
It's interesting with the gum recession too, where I've changed my diet and then it seemed to kind of you can't reverse that, I guess, but it seemed to stop it because a lot of people were getting these skin grafts and then you got to, oh my goodness, all that stuff on that piece. But as the diet kind of helps to reverse some of that.
Yeah, because it's all an inflammation based, right? So if you're putting stuff into your body that's triggering an inflammatory response, not only will you have gut issues, but you'll also have oral issues, bleeding gums, recession. Some people will notice sensitive teeth. They'll be like, oh my gosh, my teeth are so sensitive. I don't know what's going on. Well, that's a warning sign that your body is on fire or inflamed. If someone has achy, creaky joints or like just kind of pain all over, fibromyalgia, that's systemic inflammation that's going on. So any of those signs, patients should be going to a provider or doing telehealth or whatever to get these oral bacteria tests done to make sure it's not bacteria.
Yeah, that's so important actually, because I like how many of those sensitive, those different sensitive toothpastes are out there right now, because everybody seems to be like, oh, well, first of all, we're all sensitive because our skin is sensitive. We're sensitive to everything. And now our teeth are all sensitive. Yeah.
And then we're using those toothpaste and that's just covering up the symptoms, right? Sensitivity, like I said, it could be coming from systemic inflammation. It could be coming from bacteria, gum infection in the mouth. It could be coming from cavities. It could be coming from a vitamin or mineral deficiency. There's all sorts of things, or exposed root surfaces. There's so many things that sensitivity can be coming from. And if you just go to the store and buy something over the counter to mask the symptoms, you're really missing the root cause and it's just going to get worse.
Do you have like a favorite electric toothbrush that you like?
I personally love Sonicare.
Okay.
I'm not paid by them, no association or anything. I like them because it's very gentle. I mean, it's so gentle on your teeth. It's really comfortable. It's quiet. And I like the brush head size because I can do multiple teeth at one time, or a lot of people like Oral-B, but Oral-B has a round circular brush head. And that's really designed to go tooth by tooth. I don't have the attention span to go tooth by tooth. So I like the Sonicare. I can get more done.
How long are we supposed to brush our teeth for?
2 minutes.
2 minutes. Yeah.
2 minutes. I do 3 because I have that IL-6 mutation. I do 3 at night and 2 in the morning. But what's nice about those electric toothbrushes is you put it on the setting and you don't stop until it turns off. And what I tell people is, because people are really impatient and have short attention spans like I do, don't stand at your bathroom sink in front of your mirror and do it. Like if you need to walk around your house or do whatever, go do what you need to do to get it done. I also floss in bed because I like to watch TV before I go to sleep. So I have my floss sitting on my nightstand and that's where I floss my teeth because I'm not going to stand in my bathroom in front of my mirror and do it.
Yeah, I was going to ask if you're walking for 3 minutes there because I was like, geez, I don't know if I could stand there for.
Yeah, no, I walk around, I'm doing stuff the whole time, which is probably not the best advice, but you got to do what you got to do to get it done. Water pick is also really beneficial for people, especially pregnant women, because they, oftentimes are feeling nauseous and throwing up. And so sticking a piece of floss in their mouth is like the last thing they want to do. So a water pick is really nice because it'll just shoot water in between the teeth. So flossing is still the best, but if someone's like, I hate flossing, my teeth are crowded, I can't get my hands back there, then buy a water pick. That's just as good.
And what about mouthwash, like with alcohol and all that in it? What's your take on that piece?
Please don't use that. If it's burning, it's not good for you, right? Like you would never pour alcohol on your skin, right? Just pour it on there twice a day and like watch it burn. It's not good. If it's burning, it's not healthy. So please, again, use something that's super gentle. Plaque in your mouth is really soft. It really doesn't take a whole lot of pressure or force to disrupt the plaque or disrupt the biome. So you don't need something super aggressive.
And do you have any supplements that you'd recommend, like D, or like what would you recommend for
Oral health?
oral health? Yeah.
Yeah. So I have a whole section in the book about, because the book I wrote for patients to give them this information. And so I have a whole section in there that's easy things that they can do every day without the help of a dentist to improve their oral health. And so some of the vitamins and supplements I would recommend to patients is vitamin D3 with K2. K2 is super important for D3 for teeth because we want to bring calcium into our teeth. But D3 needs something to tell it where to dump the calcium. And if K2 is not part of the D3 supplement, it's going to dump it into our soft tissues. So our arteries and urinary tract system. So that's why people get, kidney stones and stuff like that, or hardened arteries. So D3, K2 is super important, not only to keep our teeth hard and strong, but it also lowers inflammation. So D3 is a very powerful anti-inflammatory. I love turmeric and curcumin. That's really good for anti-inflammatory. Magnesium is a must. Everyone is deficient in magnesium, and magnesium is the first supplement that will get eaten up if we're stressed. So if someone's going through a lot of stress, they need to be upping their magnesium intake. It's also great to take it at night. It'll help you poop. It'll help you sleep. And it also relaxes your muscles. So it helps with grinding. Vitamin C and zinc are super important for our immune system. And if I was doing surgery on a patient, it's really important for wound healing after surgery. Vitamin A is important for our teeth and gums. Those are the main, that was a lot, but yeah.
Yeah,
Those
some of
are
the similar ones for fertility too. They had the magnesium one, right? As we get stressed out and that's depleted, it's interesting. Where I was like, why is my eye twitching? Am I twitching? Am I got a cramp in my leg? And I'm like waking up.
I also love, I'm a big fan of, because I have this inflammatory issue. I'm always on like mitochondrial supplements, antioxidants, things like that. So I take N-acetylcysteine. That's a precursor to glutathione, which is a really powerful antioxidant. I also take PQQ10. So CoQ10 with PQQ. That's good for mitochondria and for fertility, good for the brain.
Absolutely. And awesome. And so, what can they, so you've got a special, offer here for some listeners. What can if they follow you at Katie Lee DDS, and leave a special code for you, what can they expect there?
Yeah. So what I'm trying to do again is I really think that anyone undergoing fertility treatment or thinking about getting pregnant needs to have a saliva test before they're undergoing all of this. And so what I'm trying to do is get the word out there to let people know, like, hey, at least look in your mouth, right? If you're going to do this. So I'm offering telehealth services now to patients to help bridge the gap between dentistry and their medical provider. So people follow me on Instagram at Katie Lee DDS. They can send me a message with code saliva23. They'll get a salivary test at cost. It's just $100. That just covers the cost of the test. And then I will do a free teledentistry consultation with them to go over their results and give them some like a personalized care plan on how they can improve their oral health.
Yeah, I think that's great. It's as I say, I don't think anyone's really thinking about this piece, right? To include this and when you're trying to get pregnant. Any final thoughts here for us, Dr. Katie?
No, I'm just excited that you guys are open to the idea and you're trying to, like you said, we're about pro health, right? And there's so many different aspects to health. And if we can start having more conversations like these and bring in every different modality possible, I think will help a lot of people. And I've been through this journey myself. It's a long and arduous one. And there's so many gaps in women's care. As you know, it's under researched, under talked about. underfunded. So just trying to do everything that I can in my power to help women have families and men have families.
Absolutely. Awesome. Great. Well, thank you very much.
Thank you.